Next topic is factors affecting the mental health. So what are the factors which affect the mental health? So the first one is heredity. In heredity, if the person is suffering from severe stress and depression, then uh, the person can suffer from neurosis. Example is neurosis, schizophrenia. So these are the mental disorder which affect the brain. And the next is physical factors. Physical factors, postures, erect postures, smile, strength. So all these things can also affect the mental health. These are the physical factors. So a good physical health is needed to have the positive mental health. And next factor is social factors. Social factors is also one of the factors which can affect the mental health. Good working condition, social participation. Good working condition and social participation, these are one of the social factors. So the development of potentialities is determined by environmental opportunities. It is also one of the factors. And next is family. Family, as we all know, family is the primary group. And here the parents are the primary caregiver to the child. So most of the majority most of the mental health depends upon the comes from the family, and a good mental health will promote the healthy attitudes, and it will also establish good interpersonal relationship. So a good if the family is mainly one of the main factors which affect the mental health, it will provide the healthy attitude to the child and also establish good interpersonal relationship, like interpersonal relationship between the family members, between the siblings, and also outside the family members, friends, colleague, all these things the person should develop. So if a child due to broken homes, and instability of the home, and conflict between the sibling can also affect the mental health. So providing a good family environment is important. Next is community. In community, that is the highest possible quality of life. So in community, it provides it mainly the family live, enjoy, and develop. So if the person is having a healthy environment from the family itself, then it will give uh, good and possible good quality of life in the community. Next is the individual factors. Individual factors, the capacity of growth, autonomy, self-esteem, these are the main thing. So they have ability to find the meaning of life and sense of belongingness, etc. These are mainly the qualities has to be developed to attain more good health. And next is the interpersonal factors. Interpersonal factors, effective communication, the ability to help others, these are one of the interpersonal factors which will promote good mental health. So, the effective communication to the family members, uh, to the colleague, community, all these things, and ability to help others will promote good mental health. Next is now satisfaction of basic needs. So some of the basic needs examples are physical, organic, emotional, social. So this has to be fulfilled to promote the well-being. Physical needs, air, food, water, clothing, and emotional needs, love and security, belonging needs, social security, self-esteem needs. All these things has to be fulfilled to promote the well-being. So all these basic needs, if it's not fulfilled, then the person will not have a good mental health. And also one more example is feeling of one, love, cooperation. These are also important for healthy relationship with others, which have to be met so that the person will have a good mental health. So the factors affecting the mental health, the first one is heredity. So a person should be, if the person is suffering from depression or stress for a long period of time, then it can also affect the mental health. And example is neurosis and schizophrenia. The physical factors are having the positive, having having good postures, smile, strength. All these things are one of the physical factors. Good physical health is needed to have the good mental health. And social factors, good working condition, social participation, these are one of the social factors. And family, mainly the parents are the primary caregiver in the family. So, a good mental health, uh, to have a good mental health, family plays the important role. It provides the healthy attitudes and also establish good interpersonal relationship. And broken homes, unstable homes, conflict between the siblings, these all these things can lead to can disturb the mental health of the child. And next is community. Community, it has the highest possible quality of life. And individual factors, autonomy, self-esteem, these are one of the individual factors. Interpersonal factors, uh, one of the most important thing is effective communication. Communication between the family members, relatives, colleagues, all these things are one of the communications, and the ability to help others is also important to promote good mental health. And satisfaction of basic needs, so example is physical or emotional, social. All these needs, basic this has to be fulfilled to promote the well-being of, and also feeling of one, love, cooperation. All these things should be fulfilled to promote the well-being and to have the good mental health.